People ask all the time, how can I become a better nurse? How can I become a better clinician? What can I do different? What course can I take? Where do I start? There's so much to do. And in healthcare settings, and particularly hospitals, there are a lot of measures, and people are constantly tracking numbers. They're looking at door to CT time for stroke, door to balloon time for patients presenting with heart attack. They're looking at sepsis core measures and so many different things about hospital acquired conditions, and it seems endless. And there really is a lot to know, and there's a lot to focus on. And so rather than trying to just jump into all these different things and not know where to even start, it's really important that you focus on a particular component of those, or whatever is the biggest need in your facility or the biggest need in your department. Start focusing on a particular component. Now, what is that component? I'll tell you in just a second. In the Journal of Burn Care and Research, published in, this is volume 44, issue 6, published November, December 2023, they have an interesting study in here that says the role of burn centers in the treatment of necrotizing soft tissue infections. And this is a study that's a Dutch study. And without getting into all the details of the study, one of the biggest things that is stated right there in bold on the front of the page is that approximately half of the patients were initially misdiagnosed on presentation. And so that's important to talk about, is that early recognition. So there's that key. What can I do to improve my clinical practice in 2024? Focus on early recognition. There are a lot of cases that happen nationwide on a weekly, hopefully not, but it could be even a daily basis, of individuals that are not recognized as having major life-threatening conditions, whether it's stroke, heart attack, sepsis, etc. Early recognition is key, and that's what a lot is based off of. So don't let another clinician be the one to recognize these. That happens, and that's great when they do, but focus that for 2024. Be the one that says, I'm going to really hone my clinical skills on the recognition piece. If you can recognize early, I promise a lot of those other measures that are looked at later, they'll all fall into place, but it starts with that early recognition. Whether you're working in a burn center, an ICU, an emergency department, or any other area of the hospital, it's really, really key that you do not allow a healthcare record to try to recognize for you, that you don't depend on other people to recognize for you, that you're in the one there assessing and advocating for these patients and determining what either is the diagnosis or what the diagnosis may potentially be, and getting the help that that individual needs. So for 2024, set your goal. You may have a lot, there may be so many different things going on and it's crazy and you don't know where to start. Set your goal to say, I'm going to focus my clinical assessment on recognizing these significant conditions early, and I promise it'll make a big impact on your patients. It'll definitely make a big impact on your career. Thank you for watching.